I am Christy McCarthy. I have been a physical therapist now for over 25 years. I've currently been working in the same physical therapy office for just over 10 years. So some of you may have had experience with physical therapy and some of you may not. Physical therapy is, I would say the background of it is based in Western medicine. So we are very much aligned with your doctor's recommendations and everyday healthcare that you would find here in the US. A physical therapist is a licensed professional. We have all gone to some sort of postgraduate schooling, graduate school. Currently, if you graduate from physical therapy school, you graduate with a doctorate degree. It takes usually 3 to 4 more years than just your undergraduate degree. We are required to keep up with continuing education. So we are abreast of current scientific studies that help support some of the things that we do, and we try to make sure that it has a good basis in science for why we do the things that we do. Physical therapy runs on the continuum of the full life. So we do see infants and school-age children. We also see young adults, kids who have sports injuries, and we see middle-aged adults who might have sustained an injury for whatever reason. And we also see the elderly population. That happens to be the area that I specialize in. Definitely work with a lot of the frail elderly or people who just want to maintain how they're doing in life or improve upon their status. We see the area of physical therapy that I work in is outpatient orthopedic therapy. So we deal with the musculoskeletal system. By that I mean musculo meaning the muscles, and obviously skeleton, the bones of the system. There are other physical therapists that are based in neurology. A neurophysical therapist would help you if you had Parkinson's or you've had a stroke. We do treat some kinds of neurological issues in my clinic. I'm also trained in a specialized area of physical therapy called vestibular therapy, which deals with balance issues or balance dysfunctions that are stemming from issues of the inner ear. Pain is the primary reason that we have patients come to see us in our clinic. So if pain is impacting your function, if pain is making it difficult for you to live the life that you want to live, that is a great reason to come to physical therapy. You might have pain because of a chronic issue, and by a chronic issue, this could be arthritis, an arthritic knee or an arthritic hip or arthritic shoulder. You might have issues of pain that are stemming from issues in your spine if you have spinal stenosis, or you have a degenerative disc in your neck or your low back. That can also create some chronic pain issues. We also deal with patients who have acute pain issues. And by acute pain, I mean pain that has started up maybe in the past few weeks to last couple months. That would be considered acute pain. Chronic pain is pain that you've been battling for months to years. So acute pain, that might have come because you started a new exercise program, or you suddenly had to do a lot of heavy lifting, or you engaged in some heavy gardening and you've developed an overuse injury. That would be an issue that we certainly could help you with. We also see patients who are post-op surgery. So if you've unfortunately fallen and sustained a wrist fracture or an ankle fracture or a hip fracture, you would probably be referred to some sort of physical therapy for that. If you've had a total knee replacement or a partial knee replacement or a hip replacement, or you've had rotator cuff surgery, all of these are definitely cases that an orthopedic doctor would be referring you to physical therapy. And so in all of those cases, chronic, acute, or post-surgery, you're likely to have pain, and physical therapy is designed to help you to try to manage that pain. How do we do that? So what happens if you come to physical therapy? You would come to our clinic and you would undergo an evaluation. And during the evaluation, we try to look at a patient in a very holistic manner, meaning if you have low back pain, I'm not going to address simply that small area of the back that is causing your pain. I'm going to attend to that, but I'm also going to look for what are the causes of this person's low back pain. Is it stemming from an overuse injury of the muscle? Is it because unfortunately they've had poor posture for many years now, and that has worn down on the skeletal system and created some changes in the discs that we need to address? Is their low back pain related to maybe a leg length discrepancy that hasn't been observed yet or problem solved? Is it related to a scoliosis of the back? So we try to look at the entire person. As we say, it's sort of a chain of events. It's not just one area that hurts, it's related to all the parts above and below. Same thing if you came in with the shoulder pain, I would be evaluating, is it your neck that is referring pain to your shoulder? Is it your shoulder because of a postural abnormality? Is it your shoulder because of a weakness or stiffness in an area of the shoulder? How do we treat the pain? We have many options in front of us. So the simplest thing that we might do would be to recommend that you use heat or ice. I want to tell you that ice is your friend. Ice is a very nice way to calm down an inflammation of a body part. It's either going to help you or it's going to do nothing, but it really can't hurt you unless you give yourself frostbite or freezer burn. So you do need to be careful and listen to your body, but 10 minutes of ice on an achy part is never a bad idea. If you come to our clinic and we felt that you would benefit from a modality called ultrasound, we might use a small machine, contains a little sound head that creates vibratory waves, and that friction in your tissue is used to warm up the injured tissue. So when I warm up a tissue, I help bring blood supply to the area. That helps with the healing. It helps to flush out any toxins that we might have from cellular death from the injury. I might be using ultrasound to prepare a tendon or a muscle for stretching. It's just a way to deep heat something. You may have also heard that sometimes we use electrical stimulation. That sounds scary, but it isn't scary. Electrical stimulation is a way to actually tell the brain to stop sensing pain. It's a way to block our pain pathways and to give them a different message. So instead of constantly saying pain, they now are feeling a different sensation. They even have on the market portable small units of electrical stimulation that's called a TENS unit. So it's one that you could use at home, and you have your own electrodes, and we can teach you how to use that for a chronic pain issue that might be helped by that. We've begun in the past few years utilizing something called Kinesio Tape. You may have seen Kinesio Tape on some of our Olympic athletes or on a local athlete at your local high school. Kinesio Tape is another way for us to give your pain pathway a different sensation so that it's not constantly saying pain in your brain. It can help make things feel a little bit better. If we found that a source of your pain was related to a stiffness in your joint, we are trained in joint mobilization. So I might need to loosen up a shoulder joint with some gentle motions to try to gain flexibility in that joint to help restore more normal motion. If I found that you had tension in some muscles or some muscle knots, we utilize massage for that reason. So we might find a trigger point and we might work at trying to release that trigger point and restore more normal muscle motion. Finally, the other ways that we might approach pain for physical therapy, if I found that you had a joint that was too tight, or a muscle that's too tight, I would certainly address this with the proper ways of stretching. We would teach you how to stretch. And oftentimes pain is related to weakness. So one of the major areas of physical therapy is teaching you the correct ways to strengthen your muscles. By visit number 6, I absolutely expect a patient to tell me that they think that we are on the right path. If I haven't heard that by about visit number 6, I need to rethink what I'm doing or perhaps refer you back to your doctor. The first person to ask would be your friends. Perhaps some of them have come to our physical therapy clinic, or ask your doctor. If you have physical therapy, our clinic does take insurance. So if you have Medicare, we have to work in conjunction with your doctor. We need to work under a prescription from your doctor. If you don't have Medicare, we are direct access, meaning you can come to our clinic without a doctor's prescription. If we feel you need care from a doctor, we will refer you to a doctor. Like normal insurance, if you have a deductible, that would have to be met. There are co-pays associated with a visit if that is part of your insurance. And then some insurances cap the amount of therapy visits that you can have in a year. So you certainly could get started with your insurance. And we do try, one of the things that we try to do is to teach you how to help yourself. So my favorite day is the day I say bye. I hope I see you in ShopRite, because I want you to feel empowered that you can help yourself. I don't want you always having to come back to me for your pain. I want to teach you how to make yourself feel better and empowered by that.
Thanks so much for joining us today. For more information, please email us at cicseniореducation@gmail.com. We'd be happy to answer any questions you may have and provide additional resources. Be well and stay safe.